On the negative effects of doping and why athletes must avoid doping.
Hello lovely viewers, my name is Dr. Odame. I'm a pharmacist. Today we are going to be talking about doping. So simply put, doping is using prohibited or banned substances, usually by these athletes to enhance performance. Okay, so we're going to talk about the various types of doping. There are several types of doping, but we're going to limit it to a few. The very common ones are blood doping, where there's going to be transfusion using erythropoietin, popularly known as EPO, to increase red blood cells, increase oxygen concentration, which in the end is going to increase these athletes' performance. Another one is the use of anabolic steroids, popularly used by these bodybuilders in order to increase muscle mass. Then we have diuretics, and other common masking agents. So a very common example is what happened to the famous footballer Onana, where he was caught using these diuretics, commonly furosemide. So what these kind of agents do are they can alter the fluid balance in the body, leading to weight loss, and they can also mask other performance enhancing drugs. Okay, so another type of doping is stimulants, the use of stimulants. So a common example is amphetamine, which increases concentration and decreases the fatigue of these people. So one may ask, why are these athletes even doping in the first place? One is to recover from injury quickly. Due to the intense pressures of the competitions that they are in, they try to dope their way out so that they can recover from their injuries very quickly. Another one is to gain unfair advantage over their opponents. And then the last but not the least is due to the financial incentives. These sporting competitions contain huge sums of money, I know, very huge sums of money. And so why not dope it and you'll be able to achieve this goal? Okay, now we are going to talk about the harmful effects of this doping. Now, there are lots of cardiovascular conditions associated with these doping agents. So some may lead to hypertension, stroke, heart attacks, not to even talk about the liver and kidney damages that are associated with these. And most importantly, the mental health of these athletes are also at stake. It can lead to serious episodes of aggression as well. Now, how do we tackle this doping? One, intensive education. Players, coaches, support staff need to be highly educated about doping and its harmful effects so that there's no room for any negligence on the side of these athletes. Another one is through strict testing. Now, through urine samples, blood samples, when they are done randomly, it might take some of these athletes unaware, and so it is very, very essential. Also, through support systems, various avenues for supporting these athletes psychologically, especially, so that they do not succumb to these pressures to dope, and also strict sanctions which are already being applied by the various organization bodies to strip them of their trophies, of their medals, so that it will serve as a deterrent to others. Thank you very much for listening to me.